Good morning. The committee will come to order. This morning we meet to mark up a total of 11 bills, all of which have my full support. I'm grateful to Ranking Member Waltz, our subcommittee chairman and ranking members, and all the sponsors of the bills on today's agenda for their efforts to advance these important pieces of legislation to the full committee. In the interest of time, I will be asking unanimous consent that after we mark up H.R. 1725 as amended, we consider the rest of our agenda en bloc. Before the en bloc vote, I will recognize any member who wishes to speak on any of the remaining bills being considered. Since we have a full agenda today, I will forego any further opening comments and yield to Ranking Member Waltz for any opening remarks you may have.
Well, thank you, Mr. Chairman. First of all, congratulations to you and your family. We're excited for you and wish you all the best. A special thank you. We have some members, Ms. Rice, and several staffers this morning that participated in a fundraising event for guide dogs for our wounded warriors, raised $600,000 the last several years. So thank you to those. And just as a side note, and I don't want to single her out, maybe that's why we don't have her here yet, Ms. Rice was the fastest woman in Congress, so just so we know.
You got to be careful how you say that.
Yeah, that's true. That's true, in a very positive way, so when you get her here. But thank you all, and again, grateful to be here today, and I will state, and when we work together in this committee, we work together well, and I would state that 9 out of the 10 bills that we're marking up today went through true regular order. They were debated, they passed out of subcommittee, they were heard in subcommittee and full committee hearings. We agree solidly on these 9 bills. It took time to get them right, but we agree. We sought input from stakeholders, working all along to make them the best pieces of legislation. I'm extremely proud of the work this committee has put in over the past 3 years to get transformative appeals reform to the President in a way that he'll be able to sign it. I want to recognize DAMA Chairman Bost and Ranking Member Esty for incredible work. You got it here. Lots of people have wanted it there, and you're working it and including stakeholders. For several years, I myself have worked with Representative Denham in a bipartisan manner to advance the Quicker Veterans Benefits Delivery Act. We'll vote on that and I believe pass it out today. The No Hero Left Untreated Act is a widely bipartisan bill that took some time to get to this markup. It will also pass unanimously. The point I'm trying to make is when we work together, we do good stuff. However, on one piece of legislation, we didn't work together, and it's obvious it ends up in a contentious full committee markup where no one, including our veterans, wins. That brings me to our 10th bill, H.R. 1461, Vet Protection Act. It has 0 co-sponsors, it's been referred to another committee, and it has no chance of passing the Senate. So why are we rushing this bill through? Is this a bill meant to truly protect veterans, or is it a veiled attempt to attack VA employees and the right to collectively bargain? I've asked this question several other times before, and today I think we're going to see if we can get an answer on it. We agree the VA should accurately track official time so we can see its value, but arbitrarily changing who can and how much any one individual can be on official time doesn't get us closer to closing the gaps in delivery of care of veterans. If we are debating union activities, then we should say we're debating union activities. If we're debating official time, which is different than union activities, then we should debate that, but we should do it in the regular order. If the goal is to understand the value of official time, work with us. Let's amend 1461 so we can make the right decisions regarding official time. My fear is that we won't do this. Rather, we're going to put this committee into a partisan fight that doesn't serve this committee or veterans well. We'll pass it along party lines. We will lose today. We will lose the vote. And then we will send it to the Senate, where, as I said on the accountability bill, if they do not change it significantly, it will not have a chance to come back. And so I know what we can do together. I've watched us do it for 10 years. The times when this Congress, we have brought things up out of regular order, they have ended contentiously. And so I would hope that today an honest, open discussion amongst all of us is had, with the goal that I know every person at this dais and every person sitting out there shares is the best quality of care for this nation's veterans in the most efficient manner possible. With that, I yield back.
I thank the gentleman for yielding. I now call up H.R. 1461. The clerk shall report.
H.R. 1461, to amend Title 38 United States Code to require the Secretary of Veterans Affairs to submit an annual report.
Bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
Clerk shall report.
an amendment in the nature of a substitute to H.R. 1461, offered by Mr. Banks.
I ask unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Representative Banks for 5 minutes to discuss his amendment in the nature of a substitute.
Thank you, Mr. Chairman. Before I discuss the changes that my amendment in the nature of a substitute makes to the underlying bill, I want to go into a little bit of detail for members and the public about what official time actually is. The Federal Service Labor Management Statute authorizes federal employees to join public sector unions and to collectively bargain with agency management. This statute also specifically authorizes the union's use of official time, which allows an employee to work on approved union activities while receiving their federal pay and benefits as if they are in a duty status. The statute authorizes the use of official time for negotiation of collective bargaining agreements, attendance at impasse proceedings, and participation in other activities of the Federal Labor Relations Authority. Unions and agencies can negotiate the use of official time for other purposes, under the condition that both parties agree it is reasonable, necessary, and in the public interest. Title V of the United States Code restricts the use of official time for any internal union business, including the solicitation of membership, elections of labor organization officials, and collection of dues, which must be performed while the employee is in a non-duty status. VA currently has 5 national master collective bargaining agreements, which, among other items, set the parameters for use of official time by union officials. There are also hundreds of agreements at the local level that also dictate the use of official time. Most local agreements provide a bank of time that can be used for official time at each facility, while also allowing a certain number of VA employees to spend 100% of their time on official time. The Subcommittee on Economic Opportunity has had 2 hearings this Congress on the use of official time and has uncovered that in 2015, the VA had almost 2,000 employees using some amount of official time, and that 340 employees were working on 100% official time. The salaries for these employees during this period cost the department over $22 million. On this list of employees using official time, there were doctors, nurses, other practitioners, and other highly skilled and highly paid VA employees. As more veterans seek care and benefits from the VA, we should be doing everything in our power to empower managers to use every available resource to help veterans instead of using taxpayer dollars to subsidize employees' salaries who spend more time on union business or business instead of doing the job they were hired to do. It makes 0 sense to pay an employee hundreds of thousands of dollars in some cases to work 100% or even a majority of their time doing union or representative duties. Employees are not hired to work as union officials, but are hired to complete the VA's mission. Members, I think we can all agree that while there may be some value in official time, we need to do a better job of tracking it and putting some meaningful restrictions on its use, striking an appropriate balance that is both fair for management and labor. I believe my amendment in the nature of a substitute strikes that appropriate balance. Specifically, the amendment in the nature of a substitute would retain the text of the underlying bill, but would make the following changes. It would add additional reporting requirements for the annual official time report that would be required by Section 2 of the underlying bill. It would modify the probationary period requirement for all new VA employees from 18 months that was in the underlying bill to 2 years, as is already the place in place for Title 38 employees at VA and other agencies such as the Department of Defense. It would supersede provisions in current collective bargaining agreements related to official time and stipulate that VA physicians, registered nurses, physician assistants, dentists, podiatrists, chiropractors, optometrists, probationary employees, or other employees with a base salary of $100,000 or more would not be allowed to use any official time. It would also stipulate that all other employees would be limited to only use 25% of their time on official time, and it would also provide the Secretary and management the authority to waive either of these restrictions to allow someone to work more than 25% of their time or even 100% of their time on official time if it is reasonable, necessary, and in the best interest of veterans. After listening to testimony from VA and the individuals representing the union at the EO Subcommittee's legislative hearing on this bill in March, I believe that including some waiver authority would provide the Secretary and VA managers the flexibility they need to address certain circumstances where they believe the official time restrictions need to be lifted. I heard from individuals at the hearing that sometimes official time is valuable to the mission of the department, and I think that this waiver authority, if used judiciously, will help reach our goal of getting VA employees back to directly providing for veterans. As I mentioned earlier, the 2-year probationary period is not a new concept, as the DoD, the FAA, and the VA already use it. I appreciate your consideration of the amendment. I yield back the balance of my time.
Thank you, gentlemen, for yielding. I'll be supporting this amendment in the nature of a substitute. I'm grateful to Representative Banks for offering it and to Representative Arrington for introducing the underlying bill. This bill would bring needed change to both how VA tracks official time and to which VA employees are able to use official time. Time that is being spent on union activities instead of providing direct services to veterans, the job that the VA employees are hired to do. For years, VA has told us that they need more health care providers and that they need the authority to increase pay for health care providers to be competitive with the private sector. For years, we've heard from the VSOs, the American public, witnesses at our hearings, and from other of our colleagues on both sides of the aisle that veterans should not have to wait weeks for an appointment and that any waiting list is unacceptable. I know we all agree on that. Yet, while there is still a shortage of health care providers at the department and while veterans are still waiting far too long in many instances to receive care, we have hundreds of health care providers such as physicians, nurses, physician assistants, dentists, etc., spending their time working for the union on the taxpayer's dollar instead of providing direct services to care for veterans. In some instances, these individuals are spending 100% of their time working for the union, again at the taxpayer's cost, instead of providing any direct care or service to veterans. As a doctor and a veteran myself, I found that unacceptable. If I want to work for the union instead of the patient, then I would have gone into a different field of work. We need to get qualified health care providers out of the union business and back in their roles and duty as a provider. That is exactly what Representative Arrington's bill does and what Representative Banks' amendment in the nature of a substitute improves upon. This is not a Republican attack on unions. This is a common sense change to the current practice. If you are hired to provide services to veterans, to provide health care to veterans, to provide benefits to veterans, then that's exactly what you should be doing. If you're making a six-figured salary funded by the taxpayer, then you should be doing the job that you were hired to do, helping fulfill the VA's daily mission. You should not be spending time on union activities. I fundamentally believe that. This amendment, in the nature of a substitute, has my full support, and this legislation is the right thing for veterans, for the VA, and for the taxpayer. Is there any other discussion on the amendment in the nature of a substitute?
Mr. Chairman.
You recognize Mr. Arrington.
Mr. Chairman, Ranking Member Waltz, I have yet to find anybody outside of Washington at the Beltway or the VA or the union that has that tells me that they believe that a VA employee who spends the majority of their time, not just 100% of the time, but a majority of their time on union activities rather than the job they were hired to do, that presumably there was a need, defined need, in serving the veterans as reasonable, necessary, or in the best interest of the public. This bill, along with the amendment from Mr. Banks, will go a long way in restoring the public's confidence in the Department of Veterans Affairs by ensuring the taxpayer dollars of hardworking Americans are focused on advancing the VA's mission. It is my hope that this bill will also give the Secretary the tools he needs to change the culture of the VA, which I think is the heart of the problem, of most of the problems that I've heard since I've been on this committee. A culture that holds VA employees accountable for putting veterans first and serving them with no less commitment than they gave to our country. I support Mr. Banks' amendment in the nature of a substitute, and I yield back to you the balance of my time, Mr. Chairman.
I thank the gentleman for yielding. Who else seeks recognition for the purpose of offering an amendment?
Mr. Chairman?
The ranking member is recognized.
I have a substitute to the amendment in the nature of a substitute to H.R. 1461.
Clerk shall report.
A substitute for the amendment in the nature of a substitute to H.R. 1461, offered by Mr. Walls.
Is unanimous consent that further reading of the amendment to the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Ranking Member Waltz for 5 minutes to discuss the substitute amendment in the nature of a substitute.
All right, I thank the gentleman. And again, finding the common ground is our goal here. Issue we all agree on, VA needs to do a better job of tracking official time. Let's be clear on terms here. I think official time is implementation of policy coming from management in many cases. So if there's a change on operating room procedures are going to be enacted, that is conveyed down from management to the folks who actually have to do it. Don't conflate that union time is not sign printing and increasing dues or whatever else that is. That is not what this is. Official time is carrying out those HR functions that there is no other way to do that. So we don't disagree on that. The majority's bill provides language that addresses this by requiring reporting measures. We're in agreement. I think it's a good goal. My amendment takes that goal a bit further and adds requirements to the VA to look at how the use of official time changes from year to year, and that reports encompasses a broader range of official time duties. Data is always a good thing, something we can't do without as legislators because we need data to legislate responsibly. If we ask questions already knowing what the answer is, we will get that answer from people. Allow the data to drive it. So today you've heard, and you're not going to hear a disagreement on this, much about how this will help provide closing gaps by making VA employees provide more direct care. That, with the data, I think is highly debatable in the efficiencies that we get out of these, what ends up being liaisons between management. If that's the case, though, I ask all of you, I'm going to give you the opportunity with amendment, take this further. Why are you focusing just on the union activities? While I don't question your motives at all, I question the logic and the way that you've implemented this. In the press release introducing this bill, it says access into timely health care for our veterans is reaching a crisis level and requires an all-hands-on-deck approach to address these needs. I'm in 100% agreement with the gentleman, 100%. However, the majority's bill would address wait time and access care to problems of VAs prohibiting employees involved in direct patient care from using official time. By your own numbers, this bill would apply to 3 doctors in the entire VA. I don't make light of that, but it is 3. By logic using to sell this bill, and if the objective is really to bring all hands on deck, we should make it apply across the board and prohibit all licensed clinical providers from administrative positions in the VA. I've asked the VA to provide me that list of all licensed medical practitioners in non-direct patient care positions. You're not surprised I'm still waiting? So in 15 minutes, I provided you with 169 of them. 2 medical doctors in management positions, who I might add, the only people ever subpoenaed here for problems were these people in these positions. 6 doctors of osteopathy, 60 nurses, 1 dentist, neuroscience, I have a whole list. None of these people are being included in your bill unless you vote for this amendment. And then these people can get out of their damn office and provide care too. If you believe that it's a management issue and if nothing they're doing here is valuable enough to them to focus on, then ask them to do that. There are 342 employees on 100% official time. Now, if I'm right, we're not even trying to get rid of all of them. We're just going to divide it up and have 682 at 50% or something like that. That's out of 340,000 employees. 3 of them are doctors. This bill would move those 3 into direct patient care. 3 out of 343, and telling us that it's all hand on deck and is going to close the gap, I can give you 169 by taking this amendment who will be seeing patients tomorrow and closing the gap at a rate of 500 times faster than this bill does. To be clear, the only thing separating these 3 physicians targeted in this bill and the others without patient care requirements is their union membership. My amendment would require that all qualified clinicians in the VA system see patients, just exactly what you've said you wanted to do. If the majority isn't going to address the much larger number of providers who are serving in administrative roles, but instead going after this number because of their union identification, it's not all hands on deck. How can anyone outside the Beltway logically say if you had the opportunity to provide 169 more doctors, you wouldn't take that opportunity? So none of us disagree. We need to hire more people. We need to retain them. But we've chosen an issue that I think is incredibly misunderstood and does not serve the best interest of the veterans, because I think when the VA starts tracking this better, as we've said, the lack of a solid HR structure in the VA requires these union members, these 342 people, to provide that, which in the long run implements policy, makes things work smoother, and improves the care of veterans. So again, this is a bigger issue. It should not come out of regular order. It should not be used to divide us. It should not single out 3 people out of all of the VA, these doctors, because of this. So I ask for members' consideration. Let's do all hand on deck. Take my amendment, and we can get a good start on it. I yield back.
I thank the gentleman for yielding, and I appreciate the ranking member's substitute amendment, the nature of a substitute, but I must oppose it at this time. And just a couple of comments. One, this is something I do know a little bit about health care and about how it's provided, since I did it for over 3 decades, and it's hard for me to remember this far back. But I had a physician this year, 47 years. There are 2 hospitals in my local community. One is a VA, and one is a regular hospital that I worked in right across the street, literally on the same campus, next to each other. And one hospital has a union, the other one does not. They both provide quality care. And let me assure you, when you're hired as a doctor somewhere, to be a doctor, that's what we expect you to do. When you're hired to be a manager, that's what we expect you to do in your job description. For instance, the chief of staff at our local VA is the chief of staff. Some chief of staff do that full time. My friend who does this works in the OR some. He still tries to provide patient care for people, and many doctors are doing that, but that's what they're hired to do, not what they've decided to be hired as a position as a physician or a nurse or a podiatrist or whatever, and then they work full time in another job. That means you've got to then hire another person to fill the clinical position. So I believe some additional reporting requirements on official time could be constructive. We've tried to do that since 1978 to substitute guts all the reasonable restrictions that would be made to official time in the collective bargaining in the second section of Representative Banks' amendment in the nature of a substitute. This means that there would continue to be no restrictions on official time and who's able to use official time. That would be nurses and doctors and individuals making more than six figures in the taxpayer-funded salary, and that the union would still be able to limit an individual's ability to leave the union when they want to. The amendment in the nature of a substitute already provides a waiver authority for the restrictions on official time. The Secretary can do that in this bill, and it's time to move forward and ensure that highly skilled and highly paid employees are providing services to veterans, once again, the job that they were hired to do. I urge all members to oppose the ranking member's substitute amendment in the nature of a substitute. Is there any further discussion on the ranking member Waltz's substitute amendment in the nature of a substitute? Hearing none, the question now occurs on the ranking member Waltz's substitute amendment in the nature of a substitute, H.R. 1461. All those in favor of the substitute amendment in the nature of a substitute to H.R. 1461 say aye.
Aye.
All opposed say no. In the opinion of the chair, the noes have it.
Mr. Chairman, I ask for a recorded vote.
The clerk shall call the roll.
Mr. Chairman,
You do speak passionately. No.
Mr. Chairman votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Kaufman. Mr. Kaufman votes no. Dr. Wenstrup. Dr. Wenstrup votes no. Ms. Radowagen.
No.
Ms. Radowagen votes no. Mr. Bost.
No.
Mr. Bost votes no. Mr. Poliquin. Mr. Poliquin votes no. Dr. Dunn. No. Dr. Dunn votes no. Mr. Arrington. No. Mr. Arrington votes no. Mr. Rutherford. No. Mr. Rutherford votes no. Mr. Higgins. No. Mr. Higgins votes no. Mr. Bergman. No. Mr. Bergman votes no. Mr. Banks. No. Mr. Banks votes no. Ms. Gonzalez-Colon.
No.
Ms. Gonzalez-Colon votes no. Mr. Walls.
Yes.
Mr. Walls votes aye. Mr. Takano.
Aye.
Mr. Takano votes aye. Ms. Brownlee.
Aye.
Ms. Brownlee votes aye. Ms. Kuster.
Aye.
Ms. Kuster votes aye. Mr. O'Rourke. Mr. O'Rourke votes aye. Ms. Rice. Ms. Rice votes aye. Mr. Carrera. Mr. Carrera votes aye. Mr. Sablon. Mr. Sablon votes aye. Ms. Esty. Ms. Esty votes aye. Mr. Peters. Mr. Peters votes aye. Mr. Chairman, the vote is 10 yeas and 14 noes.
The measure is not agreed to. Who else seeks recognition for the purpose of offering an amendment?
I'm going to try it again, Mr. Chairman.
Ranking member is recognized.
And I'm certain the outcome will probably remain the same. So I have an amendment to the amendment in the nature of a substitute.
Clerk shall report.
An amendment to the amendment in the nature of a substitute to H.R. 1461.
I ask unanimous consent that further reading of the amendment to the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Ranking Member Walsh for 5 minutes to discuss his amendment to the amendment in the nature of a substitute.
Just a simple, and I'll read you the wording on this. The act and the amendments made by this act shall take effect on the date that is 180 days after the Secretary of Veterans Affairs submits to the Congress certification that all employees of the Department of Veterans Affairs who are qualified for appointments under Section 401 are appointed to positions that provide direct patient care. We've had the debate. It's out there. I yield back, Mr. Chairman.
Thank the gentleman for yielding. Unfortunately, I must also oppose this amendment as it is not constructive. The amendment would ensure that all the provisions of the underlying amendment in the nature of a substitute and are not put in place until every clinician, including doctors, nurses appointed under Section 7401 of Title 38 United States Code, are providing direct patient care to veterans. Let's be clear who this amendment is really talking about. VA managers, chiefs of staff, medical center directors, and others appointed under 7401 who also hold advanced healthcare degrees and training. The difference between these individuals and those on official time is that these individuals were specifically hired for these high-level managerial positions. Employees on official time were hired to do a certain job, including providing health care and services to veterans, yet decided to spend a portion or a majority or all of their time on union work instead of the job they were specifically hired to do, directly helping veterans. To follow the ranking member's logic, we would be forcing VA managers to do a job they were not hired to do, but continue to allow official time employees the choice to not do a job they were hired to do. This amendment doesn't pass the smell test, and it's just another attempt to gut the bill and maintain the status quo. I urge all members to oppose this amendment, which we will roll to the end of this amendment series. Are there any other discussion? Is there any other discussion on Ranking Member Walsh's amendment to the amendment in the nature of a substitute? Hearing none, who else seeks recognition for the purpose of offering an amendment? Mr. O'Rourke.
Sorry, this is, are you asking for the next amendment? I have an amendment in the nature of a substitute.
The clerk shall report.
An amendment to the amendment in the nature of a substitute to H.R. 1461, offered by Mr. O'Rourke.
I ask unanimous consent that further reading of the amendment to the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Mr. O'Rourke for 5 minutes to discuss his amendment to the amendment in the nature of a substitute.
Thank you, Mr. Chairman, and I apologize. I thought we were still discussing Mr. Wall's amendment, which deserved my full attention, and I'm sorry I didn't give it to him. Let me begin by thanking my colleague from Texas, Mr. Arrington, with whom I serve on the Economic Opportunity Subcommittee and who has held hearings on this issue, and I think is doing his best, along with the other subcommittee members, to get to the bottom of this and understand the value of official time to those whom we serve, the veterans. That's all that really matters at the end of the day. And I think we are all working towards that goal, ensuring that we have the best quality of care that is delivered in a timely fashion, treating every single veteran with dignity and respect. I know that's what he wants to get to. That's what I want to get to. That's what the other members of the committee want to get to. And I will extend that same sentiment to Mr. Banks, who offered the amendment in the nature of a substitute today, who also wants to get to that. But I would like to say this, Mr. Chairman. I hear perhaps an unintentional conflation of official time, which means one thing, and union time, which means something completely different. Official time is time that is spent in service to the treatment and care and the quality of that care and the timeliness of that care to the veteran. That has value. I think everyone has said that in one way or another. Union time, which is not spent on the public's dime or at the expense of veterans, is something else that the union has to account for on their own that we are not talking about today. When we look at Government Accountability office's report on official time. Here, and Mr. Arrington brought this up, that perhaps outside of Washington, no one sees value in this. When they spoke to the managers at VAs across the country, those managers who were responsible for delivering that care cited the value that they found in official time, whether it was ensuring that we had the best information on wait times that might not have come up through the process on their own, whether it was setting more effective and efficient nursing schedules, whether it was incorporating substance abuse treatment into behavioral and mental health programs. These are all things that were products and a result of official time. That is real value. I share Mr. Arrington, Mr. Banks, and the chairman's deep concern, frustration, and absolute disappointment in the VA at their failure to track official time. That is unforgivable, and I have not heard a good excuse for why the VA has not done that. I'm also deeply disappointed that the VA says at the best they can begin tracking that effectively in July of 2018. But until we track that official time, until we have the data that the ranking member spoke about, I know that we will not be able to make informed decisions. We are, at best, going to be operating on anecdote. And when we're talking about the millions of dollars spent on official time in the context of billions of dollars spent on veterans care, or a certain number of employees spent doing official time in the face of millions of employees and volunteers and veterans involved in this process, I don't think that we have the complete picture necessary to change something that all of us agree has, at a minimum, some value, the delivery of care for veterans. And when it comes to 100% official time, I have spoken to managers at VA clinics and medical centers in Texas, and they tell me that it is valuable to them to know that there is one person that they can go to 100% of the time who's going to provide an effective and efficient, timely response so they can get back to treating veterans or improve the processes or systems that are necessary to treat veterans more effectively. I would hate to lose that effectiveness and efficiency based on anecdote without having the full data. So this amendment ensures that we collect all of the necessary data and that the comptroller then analyzes it to find the answers to the very legitimate questions that have been raised by members of this committee. And then we can decide whether we are creating longer wait times by having providers use official time, whether there is some effectiveness lost when an employee is using 100% of official time, or whether we gain more efficiency and effectiveness in that, and any number of other questions that have been raised. I've been at all of these hearings in the subcommittee and in the full committee, written our notes down on the questions asked, and resolved them in this amendment. So I ask my colleagues to join me in making sure we make fully formed decisions in the best interest of the veterans. This amendment will allow us to do that. And with that, Mr. Chairman, I yield back.
I thank gentlemen for yielding, and I appreciate the spirit, Mr. Warwick, of the amendment, but I must oppose it at this time. The amendment would completely strike out the limitations on official time and would remove the flexibility for an employee to stop paying union dues at any time. Instead, it would require another Government Accountability Office study into the use of official time at VA. There have been studies dating back to 1979 examining official time and how it's not properly tracked. And as most of you know, we had another GAO study, which you referred to, that examined these issues. It was released in February of this year. I also do not believe the GAO is capable of completing the study as written because, as the committee found in crafting requests for the latest study, GAO tends to avoid making value judgments like the ones required by this amendment. We have taken this bill through regular order and have established a record that this bill and this amendment in the nature of a substitute are reasonable, necessary, and in the public interest. Simply put, I believe that 40 years of the status quo is enough, and that if the American people truly understood official time, they would agree with me that the time for studying of this issue is over. I urge all members to oppose this amendment. Is there any other discussion of Mr. O'Rourke's amendment, the amendment in the nature of a substitute? Hearing none, who else seeks a recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment to the amendment in the nature of a substitute to H.R. 1461.
The clerk shall report.
An amendment to the amendment in the nature of a substitute to H.R. 1461, offered by Mr. Takano.
I ask unanimous consent that further reading of the amendment to the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Mr. Takano for 5 minutes to discuss his amendment to the amendment in the nature of a substitute.
Well, thank you, Mr. Chairman. I am very concerned about the provisions in this bill to drastically limit official time, especially considering that we currently do not have accurate data on how much official time has been used in the last 5 years. To push this legislation through without knowing how it will ultimately affect the ability of VA employees to report malfeasance or unsafe conditions, and how that could hurt the quality of services veterans receive is alarming. What we do know is that there are 49,386 vacant positions at the VA, according to the Department of Veterans Affairs report of vacancies submitted in April of this year. Filling those vacancies so veterans can get the care and services they deserve should be the immediate priority of this committee. Instead, we're considering a bill that is a solution in search of a problem. As Ranking Member Waltz already pointed out, this legislation does little compared to other policies to strengthen the VA's healthcare workforce. Instead, this bill would limit the use of official time, further straining the HR capability of the VA to address these vacancies and attract the best talent to care for our veterans. We also know that official time can benefit the VA and veterans. In Pittsburgh, AFGE Local 2028, Kathleen Dahl, president of that union, Kathleen Dahl, used official time to press the VA to address Legionnaire's disease outbreak, Legionnaire's disease outbreak that killed 6 veterans and made 16 others sick. Her actions helped save veterans' lives, and she used official time to do it. And at the Phoenix VA, there was a 29% turnover rate for licensed practical nurses. Union representatives used official time to work with management to improve working conditions and cut the turnover rate in half. Less turnover means better care for veterans. Employees often go through their union representatives not only to report issues, but also to navigate grievance procedures and their rights to due process. HR employees at the VA are already stretched thin, and reducing the resource of official time employees further restricts VA's capability to quickly process applicants and fill positions. This will hurt the VA's ability to care for veterans, which really should be our main concern. Now, my amendment requires that we prioritize addressing vacancies at the VA, and it would delay implementation of this legislation until 180 days after the Secretary certifies that all 49,386 vacancies have been filled, putting veterans and their care first. If this committee is truly concerned with improving access to care, we should recommit to addressing these vacancies at the VA before we move forward with this legislation. I urge my colleagues to support this amendment so we can protect the quality of care of veterans, protect the quality of care veterans receive at the VA. Thank you, Mr. Chairman. I yield back.
I thank the gentleman for yielding, and this amendment is not constructive. The amendment stipulates that none of the underlying legislation may go into effect until VA certifies to Congress that all 49,386 vacancies at the department have been filled. And just to let you know, I was at my local VA and spoke with the director Monday, and he has a plan in place in which to fill his vacancies over the next 2.5 years to find qualified people, and good directors are doing that right now. This amendment is certainly not constructive, as a department as big as VA with 380,000 employees will never have a time when there are not vacancies. I would also argue that the enactment of this legislation would get people back into their jobs where they actually were hired to do, and would cut down on vacancies and would cut down on duplicative positions managers have to address and try to budget for when their employees are on 50 or 100% union time. We all know that hiring process at the VA needs to be fixed, and unlike this amendment, Dr. Winstrup's bill, H.R. 1367, which passed out of this committee and the full House with broad bipartisan support, is a down payment on addressing this problem. I urge all members to oppose this amendment. Is there any other discussion on Representative Takano's amendment to the amendment in the nature of a substitute? Hearing none, who else seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have another amendment to the amendment in the nature of a substitute.
Mr. Takano, you recognized.
Well, thank you again. We can't make strides. Until we.
The clerk, excuse me, just 1 minute. The clerk needs to report your.
Oh, I'm sorry.
First.
An amendment to the amendment in the nature of a substitute to H.R. 1461, offered by Mr. Takano.
Let's see. Yeah, here we are. I ask unanimous consent that further reading of the amendment to the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. Now recognize Mr. Takano for 5 minutes to discuss his second amendment to the amendment in the nature of a substitute.
Thank you, Mr. Chairman. I appreciate it. Well, Mr. Chairman, we can't make the strides we need to fill vacancies at the VA and attract and retain the best talent without a robust investment in human resources. And yet we know that this has been a consistent weakness at the VA. In 2015, the attrition rate of HR professionals at the VA was 12%, and HR professionals ranked third on VHA's critical occupations list in the 2016 Workforce and Succession Strategic Plan. In fact, the bipartisan co-chairs of the Commission on Care testified before this committee that they were stunned by the lack of HR training and infrastructure at the VA, and that is with the assistance of employees using official time. The fact is, we don't have clear data on the impact that this bill will have on the VA's HR capabilities. It's not a stretch to assume that the extreme limitations on official time in this bill would place an added burden on the VA's HR professionals. They'll have to pick up additional responsibilities for basic functions like leading health and safety trainings, implementing the new management directives, and guaranteeing whistleblower protection. My amendment requires the Secretary to submit a report to this committee and our colleagues in the Senate identifying the increased resources, including personnel and costs, the VA needs to meet these added HR demands. The report must be submitted no more than 180 days after enactment of this legislation. And the Secretary must compare the HR needs of the agency under current law with the agency's needs if this bill takes effect. Now, it is unwise to move forward legislation before we have a better understanding of its full impact. My amendment asks the Secretary to report on the additional resources the VA would need for the following: health and safety training, whistleblower protection, reporting fraud and abuse, implementing new management directives, and gathering information on workplace discrimination. Additionally, my amendment delays the effective date of this legislation until the Secretary of Veterans Affairs can certify to Congress that each human resources position in the Department of Veterans Affairs that is vacant as of the date of the enactment of this act has been filled. Now, I know everyone on this committee wants to do what is right for veterans and guarantee that they have timely access to the quality care they deserve. VA's HR professionals play a key role in hiring and retaining the healthcare providers our veterans need. Placing arbitrary limits on the use of official time will burden HR professionals and, in the end, run counter to that goal. I urge my colleagues to support this amendment so we can all have the facts we need to ensure that we're best serving our veterans. I thank the Chairman, and I yield back.
Thank you, Mr. Takano, for yielding. And the amendment is duplicative and is a poison pill for the changes proposed in the amendment in the nature of a substitute. The report the Secretary will be required to submit to Congress on the impact of resources required to implement the amendment in the nature of a substitute is duplicative of the purpose of Congressional Budget Office as an institution and what was the CBO estimate that will accompany the bill articulate. So let me save everyone a little time and let you know what the CBO has already told the committee informally, that this bill will have little or no impact on the department's $75 billion discretionary budget. The amendment would also require that every current human resource vacancy be filled before the provisions of the amendment in the nature of a substitute could be implemented. This amendment is also clearly meant as a poison pill that would essentially block enactment of the bill, because just like Representative Takano's previous amendment, this vacancy list would be nearly unobtainable, and it's not how Congress should legislate effective dates of legislation. I urge all members to oppose. And just in closing, Key points, the underlying bill and the bank's amendment do not eliminate official time. It only places a reasonable restriction on that time. Number two, the reasonable restriction can be waived if the Secretary deems it necessary, as Mr. O'Rourke stated in places like Texas where he said things were working well. There was no data supporting the use or need for official time in 1978 when this was passed, and to hold up that restriction by citing a lack of data is not reasonable. The bill did go through regular order. The OGR HVAC oversight hearing in February, E&O subcommittee legislation, and now a full committee markup. Is there any further discussion on Mr. Takano's second amendment in the nature of a substitute?
Mr. Chairman,
You're recognized.
we're in agreement on the data piece. Would it be possible for us to get the CBO score before we do this? Or even the informal discussion? Because again, if it's regular order, I'm sitting here as the ranking member. This is the first I've heard of this. No informal discussion, no official discussion. That's important data for us to have in our possession before we're asked to make these decisions that Mr. O'Rourke's point was, we might not necessarily be in disagreement with you. And this is an important point, but I'm asking all of you if it's okay for that not to be passed on for us to make those decisions. So again, what is our hurry before we can get everything there? I understand, and again, I ask you, if this goes through the whole process, goes through the Senate, and gets signed by the President, it's 3 doctors through that. Why, if there's more that couldn't be added to this, wouldn't we take the time to do that? So if we can get that, I'd appreciate it, and I yield back.
I thank the gentleman for yielding back. Mr. Clark, would you like to make a comment?
Yes, sir. Just to respond to the ranking member's comment, we have received an informal estimate from the Congressional Budget Office that the score for this bill would be an asterisk or less than $500,000 impact over the 5-year window if it was enacted. Thank you.
Thank you, Mr. Clark. Is
Mr.
there any
Chair.
other discussion
Mr.
on
Chair.
Mr. Takano's second amendment?
Mr. Chair, I'm
Yes.
sorry, can I just make a point of order? When there is a CBO score provided on a bill or an amendment that is being considered, wouldn't it be the normal process to share that with all members of the committee? Or was that only shared with the Republican members
No,
of the committee?
I think it should be shared with all members, and I don't know
Because
that I
I'm
have
surprised
that.
this is
I don't
the
know that
first
I have
I've learned of
seen
it.
that. We could, yeah.
Sir, I would just respond that typically for our markups, ma'am, we have informal estimates that come from the Congressional Budget Office. They don't normally provide us a full estimate until the full committee markup is complete.
I'm just saying an informal estimate, if it's been provided to some members of the committee, ought to be provided to all members of the committee. I yield back. Thank you.
I thank the gentlelady's comment. Any further discussion on Mr. Takano's second amendment? Hearing none, since no other amendments were timely filed, the question now occurs on Representative Takano's second amendment to the amendment in nature of a substitute to H.R. 1461. All those in favor of the amendment to the amendment in the nature of a substitute say aye. Aye. All opposed say no. In the opinion of the chair, the noes have it. Mr. Takano's second amendment.
Mr. Chairman, I request a vote.
The recorded vote has been requested. Clerk shall call the roll.
Mr. Chairman.
No.
Mr. Chairman votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Kaufman.
No.
Mr. Kaufman votes no. Dr. Wenstrup.
No.
Dr. Wenstrup votes no. Ms. Radowagen.
Nope.
Ms. Radowagen votes no. Mr. Bost.
No.
Mr. Bost votes no. Mr. Poliquin. Mr. Poliquin votes no. Dr. Dunn. Dr. Dunn votes no. Mr. Arrington. Mr. Arrington votes no. Mr. Rutherford. Mr. Rutherford votes no. Mr. Higgins. Mr. Higgins votes no. Mr. Bergman. Mr. Bergman votes no. Mr. Banks. Mr. Banks votes no. Ms. Gonzalez-Colon.
No.
Ms. Gonzalez-Colon votes no. Mr. Walls.
Aye.
Mr. Walls votes aye. Mr. Takano.
Aye.
Mr. Takano votes aye. Ms. Brownlee. Ms. Brownlee votes aye. Ms. Kuster.
Aye.
Ms. Kuster votes aye. Mr. O'Rourke. Mr. O'Rourke votes aye. Ms. Rice? Ms. Rice votes aye. Mr. Carrera? Mr. Carrera votes aye. Mr. Sablon? Mr. Sablon votes aye. Ms. Esty? Ms. Esty votes aye. Mr. Peters? Mr. Peters votes aye. Mr. Chairman, the vote is 10 yeas and 14 noes.
The amendment's not agreed to. And now, since no other amendments were timely filed, the question now occurs on Representative Takano's first amendment to the amendment in nature of a substitute to H.R. 1461. All those in favor of the amendment to the amendment in the nature of a substitute say aye. Aye. All opposed say no. In the opinion of the chair, the noes have it.
Mr. Chairman, request a recorded vote.
Recorded vote has been requested. Clerk shall call the roll.
Mr. Chairman?
No.
Mr. Chairman votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Kaufman? Mr. Kaufman? Ms. Radowagen?
No.
Dr. Wenstrup?
No.
Dr. Wenstrup votes no. Ms. Radowagen?
No.
Ms. Radowagen votes no. Mr. Bost?
No.
Mr. Bost votes no. Mr. Poliquin? Mr. Poliquin votes no. Dr. Dunn? Dr. Dunn votes no. Mr. Arrington? Mr. Arrington votes no. Mr. Rutherford? Mr. Rutherford votes no. Mr. Higgins? Mr. Higgins votes no. Mr. Bergman? Mr. Bergman votes no. Mr. Banks? Mr. Banks votes no. Ms. Gonzalez-Colon?
No.
Ms. Gonzalez-Colon votes no. Mr. Walls?
Aye.
Mr. Walls votes aye. Mr. Takano?
Aye.
Mr. Takano votes aye. Ms. Brownlee? Ms. Brownlee votes aye. Ms. Kuster?
Aye.
Ms. Kuster votes aye. Mr. O'Rourke? Mr. O'Rourke votes aye. Ms. Rice? Ms. Rice votes aye. Mr. Carrera? Mr. Carrera votes aye. Mr. Sablon? Mr. Sablon votes aye. Ms. Esty? Ms. Esty votes aye. Mr. Peters? Mr. Peters votes aye. Mr. Kaufman? Mr. Chairman, the vote is 10 yeas and 13 noes.
The amendment is not agreed to. Is there any other discussion on Mr. O'Rourke's amendment to the amendment in the nature of a substitute? Hearing none, and since no other amendments were timely filed, the question now occurs on Representative O'Rourke's amendment to the amendment in the nature of a substitute to H.R. 1461. All those in favor of the amendment to the amendment in the nature of a substitute to H.R. 1461 say aye. Aye. All those opposed, no. In the opinion of the chair, the noes have it.
Mr. Chairman, I ask for a recorded
A
vote.
recorded vote has been requested. The clerk shall call the roll.
Mr. Chairman?
No.
Mr. Chairman votes no. Mr. Bilirakis? No. Mr. Bilirakis votes no. Mr. Kaufman? No. Mr. Kaufman votes no. Dr. Wenstrup? No. Dr. Wenstrup votes no. Ms. Radowagen?
No.
Ms. Radowagen votes no. Mr. Bost?
No.
Mr. Bost votes no. Mr. Poliquin? Mr. Poliquin votes no. Dr. Dunn? Dr. Dunn votes no. Mr. Arrington? Mr. Arrington votes no. Mr. Rutherford? Mr. Rutherford votes no. Mr. Higgins? Mr. Higgins votes no. Mr. Bergman? No. Mr. Bergman votes no. Mr. Banks?
No.
Mr. Banks votes no. Ms. Gonzalez-Colon?
No.
Ms. Gonzalez-Colon votes no. Mr. Walls?
Yes.
Mr. Walls votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Brownlee? Ms. Brownlee votes aye. Ms. Kuster? Ms. Kuster votes aye. Mr. O'Rourke? Mr. O'Rourke votes aye. Ms. Rice? Ms. Rice votes aye. Mr. Carrera? Mr. Carrera votes aye. Mr. Sablon? Mr. Sablon votes aye. Ms. Esty? Ms. Esty votes aye. Mr. Peters? Mr. Peters votes aye. Mr. Chairman, the vote is 10 yeas and 14 noes.
Thank you. Mr. O'Rourke's amendment to the amendment in nature of substitute to H.R. 1461 is not agreed to. I ask unanimous consent that Mr. Kaufman be allowed to vote on the first amendment, Mr. Takano's. No objection. No objection. How would you be recorded?
Mr. Chairman, I would be recorded as a no vote.
Okay, thank the gentleman. Is there any other discussion on Ranking Member Waltz's amendment to the amendment in the nature of a substitute? Hearing none, and since no other
Mr. Chairman, I'm sorry. Could I submit to the record letters opposing this legislation from National Nurses United, the American Federation of Government Employees, and AFSCME?
Without objection, so ordered.
Thank you, Mr. Chairman. I yield back.
Sir, and since no other amendments were timely filed, the question now occurs on Ranking Member Waltz's amendment to the amendment in the nature of a substitute to H.R. 1461. All those in favor of the amendment to the amendment in the nature of a substitute to H.R. 1461 say aye.
Aye.
All opposed say no.
The ayes have it.
In the opinion of the chair, that weak no carried today.
Mr. Chairman, we request a recorded
A
vote.
recorded vote has been requested. The clerk shall call the roll.
Mr. Chairman.
No.
Mr. Chairman votes no. Mr. Bilirakis. No. Mr. Bilirakis votes no. Mr. Kaufman.
No.
Mr. Kaufman votes no. Dr. Wenstrup. No. Dr. Wenstrup votes no. Ms. Radewagen.
No.
Ms. Radewagen votes no. Mr. Bost.
No.
Mr. Bost votes no. Mr. Poliquin.
Their other work.
Mr. Poliquin votes no. Dr. Dunn. Dr. Dunn votes no. Mr. Arrington. Mr. Arrington votes no. Mr. Rutherford. Mr. Rutherford votes no. Mr. Higgins. Mr. Higgins votes no. Mr. Bergman. Mr. Bergman votes no. Mr. Banks. Mr. Banks votes no. Ms. Gonzalez-Colon.
No.
Ms. Gonzalez-Colon votes no. Mr. Walls.
Aye.
Mr. Walls votes aye. Mr. Takano. Mr. Takano votes aye. Ms. Brownlee. Ms. Brownlee votes aye. Ms. Kuster. Ms. Kuster votes aye. Mr. O'Rourke. Mr. O'Rourke votes aye. Ms. Rice. Ms. Rice votes aye. Mr. Carrera. Mr. Carrera votes aye. Mr. Sablon. Mr. Sablon votes aye. Ms. Esty. Ms. Esty votes aye. Mr. Peters. Mr. Peters votes aye. Mr. Chairman, the vote is 10 yeas and 14 noes.
The amendment to the amendment in the nature of a substitute to H.R. 1461 is not agreed to. The question now occurs on Representative Banks' amendment in the nature of a substitute to H.R. 1461. All those in favor say aye. Aye. All opposed say no.
No.
Opinion of the chair, the ayes have it.
Mr. Chairman, we request a recorded vote.
A recorded vote's been requested. The clerk will call the roll.
Mr. Chairman.
Yes.
Mr. Chairman votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Kaufman. Mr. Kaufman votes aye. Dr. Wenstrup. Dr. Wenstrup votes aye. Ms. Radewagen.
Yes.
Ms. Ragavadan votes aye. Mr. Bost.
No.
Mr. Vost votes no. Mr. Poliquin. Mr. Poliquin votes aye. Dr. Dunn. Dr. Dunn votes aye. Mr. Arrington. Mr. Arrington votes aye. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Higgins. Mr. Higgins votes aye. Mr. Bergman. Mr. Bergman votes aye. Mr. Banks. Mr. Banks votes aye. Ms. Gonzalez-Colon.
Yes.
Ms. Gonzalez-Colon votes aye. Mr. Walls.
No.
Mr. Walls votes no. Mr. Takano.
No.
Mr. Takano votes no. Ms. Brownlee. Ms. Brownlee votes no. Ms. Kuster. Ms. Kuster votes no. Mr. O'Rourke. Mr. O'Rourke votes no. Ms. Rice. Ms. Rice votes no. Mr. Carrera. Mr. Carrera votes no. Mr. Sablon. Mr. Sablon votes no. Ms. Esty. Ms. Esty votes no. Mr. Peters. Mr. Peters votes no. Yeah, so that's 13 yeas.
This is not like the last Academy Awards thing, is it, to get the vote?
I think it's going to be 14.
Yeah.
13.
Mr. Chairman, the vote is 13 yeas and 11 noes.
Thank you. H.R. 1461, as amended, is agreed to. I now recognize Mr. Arrington for a motion on reporting H.R. 1461 as amended.
Thank you, Mr. Chairman. I move that we report favorably H.R. 1461 as amended to the full House.
Wait just a minute. We've got to vote on the bill as amended first.
Gotcha.
We got to do that first. So the clerk will call the roll. We'll ask for a recorded vote.
Mr. Chairman.
Yes.
Mr. Chairman votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Dr. Wenstrup.
Yes.
I'm sorry, Mr. Kaufman.
Yes.
Mr. Kaufman votes aye. Dr. Wenstrup.
Yes.
Dr. Wenstrup votes aye. Ms. Radowagen.
Aye.
Ms. Radowagen votes aye. Mr. Bost.
No.
Mr. Bost votes no. Mr. Poliquin. Mr. Poliquin votes aye. Dr. Dunn. Dr. Dunn votes aye. Mr. Arrington. Mr. Arrington votes aye. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Higgins. Mr. Higgins votes aye. Mr. Bergman. Mr. Bergman votes aye. Mr. Banks. Mr. Banks votes aye. Ms. Gonzalez-Colon.
Yes.
Ms. Gonzalez-Colon votes aye. Mr. Walls.
No.
Mr. Walls votes no. Mr. Takano.
No.
Mr. Takano votes no. Ms. Brownlee. Ms. Brownlee votes no. Ms. Kuster. Ms. Kuster votes no. Mr. O'Rourke. Mr. O'Rourke votes no. Ms. Rice. Ms. Rice votes no. Mr. Carrera. Mr. Carrera votes no. Mr. Sablon. Mr. Sablon votes no. Ms. Esty. Ms. Esty votes no. Mr. Peters. Mr. Peters votes no. Mr. Chairman, the vote is 13 yeas and 11 noes.
I think the H.R. 1461 as amended is agreed to, and now we recognize Mr. Arrington for a motion on reporting H.R. 1461 as amended.
Thank you, Mr. Chairman. I move that we report favorably H.R. 1461 as amended to the full House.
All those in favor say aye. Aye. All opposed, no. In opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 1461 as amended is reported favorably to the full House. I'll now call up H.R. 2288. The clerk shall report.
H.R. 2288, to amend Title 38 United States Code to reform the rights and processes relating to appeals of decisions.
The bill was circulated in advance pursuant to committee rules without objection to first reading is dispensed with. H.R. 2288 was jointly introduced by the Subcommittee on Disability Assistance and Memorial Affairs, Chairman Bost, and Ranking Member Esty, and every single member of this committee is an original co-sponsor. This is a bipartisan, bicameral proposal, and I am proud to support it. One reason this bill enjoys such strong support is because we all know that Congress must act now to reform and improve VA's outdated appeals process. Appeal reform is also one of Secretary Shulkin's top priorities. The current appeals process is cumbersome, to say the least, and confusing for veterans and their families. Moreover, in the past 2 years, the number of pending appeals at the Department of Veterans Affairs has increased by 95,000, from 375,000 to 470,000, and more appeals are filed every day. H.R. 2288 was drafted with the input from VA and the veteran service organizations that work directly with veterans to file claims and appeals, and it would modernize the current antiquated appeals process by giving veterans more options to pursue appeals. For example, under this bill, a veteran would choose to waive a hearing or submit new evidence in exchange for getting a faster decision on their appeal. I'm optimistic that we'll be able to actually pass appeals reform legislation this year and get it signed into law, and am committed to keep talking with Senator sponsors, Chairman Isaacson and Senator Blumenthal, along with Senate Ranking Member Tester, to resolve a few minor differences between the House version and the Senate version. To do my part as chairman of this committee, I intend to get this bill on the floor quickly so that we can send it over to the Senate and get it to the President's desk as soon as possible. Once the bill is signed into law, VA will be able to start reforming the system and reducing the huge backlog of appeals. And after listening to the debate the other day, I really do think, I was undecided until I heard the debate. I really think this bill can make a difference. I really believe it can if it's implemented properly. Do any other members wish to comment on 2288? Mr. Walsh, you're recognized.
Thank you, Mr. Chairman, and thank you to you for your guidance, your leadership, and I think the proactive manner that someone had needed to tackle this, and all of us knowing it's been a while. So I thank you for that. A special thank you also to our subcommittee chairman, Bost, and ranking member Esty. Your bipartisan work on this and your passion really has moved this to a point where I agree with you. I think we've got a chance not only to pass legislation, but to impact positively the appeals process. And for all of us here, that's what we were sent to do, and that's something we can be, I think, proud of. I'd like to give a special thank you to Ms. Titus for her work in the last Congress, and I appreciate the chairman's having her here to testify. That was thoughtful and very much appreciated. Once-in-a-generation opportunity to reform the disability claims process sets right in front of us. I'm happy we're moving the legislation forward. Long time coming. I want to pay tribute to the role the VSO community has played. They've been at the table the whole way. The chairman is right. We're still working on things. It's been an ongoing process. Many members of VSOs back home and across the country need to know that the advocates they send to Washington on their behalf are helping inform our work. They make sure we get it right, and they hold us accountable. Without them, the best policy ideas and technical expertise would mean nothing, because we would not have the coalition it takes not only to pass it, but to implement it. The involvement of the entire VSO community will continue to be essential on implementing this bill. I want to thank the VA and Secretary Shulkin for the integral role that VA has played from the beginning. VA helped pull stakeholders together. They provided expertise, and they consistently made appeals reform legislation a top priority for the past 3 years. Veterans need this legislation to be passed into law. System's broken. We need to fix it. We must keep a close eye on the legislation as it moves through the Senate and then to the President's desk in implementation. We must and we will continue to identify shortcomings in disability claims system, because this piece of legislation is not the silver bullet. We cannot pass it and then forget about it. We must continue to refine the process. I'd like to thank the chairman for bringing up the bill that will also help gather the data for private medical insurance we'll talk about in a minute, that I think is another piece of this. With that, thank you to all involved with this. When we're working this way, we're at our best, and I'm proud to step beside the chairman as he moves, I think, a historic piece of legislation forward. I yield back.
I thank the gentleman for yielding. Does anyone else wish to speak? Mr. Bost, you're recognized.
Thank you, Mr. Chairman, and thank you to the ranking member as well as for his support and working with us on this. And I want to thank you for allowing this to move forward. I want to also thank all members of the committee for being original co-sponsors of H.R. 2288, the Appeals Improvement and Modernization Act of 2017. The committee has always been special for its ability to set aside ideological differences and work together to serve veterans, and I'm proud to sit among you. I'd also like to especially thank DAMA's ranking member, Mrs. Estes, for working closely with me to get this bill over the finish line. Thank you very much. H.R. 2288 is an improved version of the draft bill that we had a hearing on 2 weeks ago. H.R. 2288 will streamline the appeals process and give veterans more choices when they decide to pursue an appeal. It also allows some veterans who are already appealing their decisions to opt in the new system. But in response to some of the suggestions we received from the department and VSOs, we have made a few changes to the draft proposal since the May 2nd hearing. For example, one of the changes would be to ensure that H.R. 2288 should not be construed to eliminate the right of a veteran to file a motion for revision based on clear and unmistakable error. H.R. 2288 would also give VA the ability to either phase in the reform or conduct a pilot program. However, the bill does not require the Secretary to do so. There are a few other technical changes to better clarify the bill. And I hope that as we continue to work and talk about this, our friends in the Senate, they will pass a bill that we will sign into law very, very soon. And thank you, Mr. Chairman, and I thank all of you for all the support on H.R. 2288, and I yield back.
Thank you, gentlemen, for yielding, and again, your hard work on this, Mr. Chairman. Anyone else wish to speak? Ms. Esther, you're recognized.
I want to thank you, Chairman Rowe and Ranking Member Waltz, for holding today's markup of several important bills for our nation's veterans. And I specifically want to thank my chairman of the DAMA subcommittee, Mr. Bost, who has worked so well and collaboratively in our process today. It is very important to recognize, as Ranking Member Waltz did, the essential role that the VSOs and the VA have played in constructively working with us to do what our goal is here today, which is to improve the process for veterans, to address the backlog in an appropriate and fair way. And want to thank all of you for your essential work in helping us move this forward. The current process is failing veterans. It's chipping away at any faith they have that if they have a claim in the system that it will be appropriately and timely dealt with. And we need and we must do better. It's important that we pass this bill for the 470,000 appeals of veterans currently in the system, but also for those currently serving in uniform. They're serving in uniform, and they deserve to know that if they incur an injury during the course of that service, that when they come home, that this process will work for them too. And we owe them that, not to be worried about that when they look at this backlog and think, if heaven forbid something happens to them and for their families, to know that we stand ready to address this problem before they come home. It's not a perfect bill. It's not. No bill ever is. But this bill makes really important steps. It's a critically and urgently needed updating of a 30-year-old process, and it's now grinding to a halt. We need to move this forward today. We need to get it to the Senate to continue to engage with the VA and the VSOs, and I'm so encouraged because, truthfully, nothing will get done in Washington long-term unless we work together, unless we hold hands, work together, and when things aren't perfect, which they won't be, we commit to stay at it, to stay on top of it, to provide the funding, to provide the oversight, and ensure that our intentions are met. So again, I want to thank everyone here for their hard work. It is far from over, but today we have an important opportunity to move this vastly better and yet still imperfect bill forward. To all of our colleagues on the House floor, and again, I want to thank Chairman Boss, thank Chairman Rowe and Ranking Member Waltz for their hard work, and for the entire committee for working so hard on this vitally needed legislation. Thank you, and I yield back.
Thank you, Gillette, for yielding, and your hard work on this also. It was exemplary, and I think what you described was the Butch Cassidy and the Sundance Kid. We grab hands and go together. Does anyone else wish to speak on 2288? Mr. Takano, you recognized.
Mr. Chairman, very briefly, I just want to say how proud I am of this committee's work on this bill. I definitely want to reiterate what the chairman said about Ms. Titus and her hard work laid the foundation for this, and Chairman Bost and Ranking Member Esty, thanks for building upon that foundation. I'm proud because I think this is a little bit of evidence that Congress can work, that there is still bipartisanship, and I'm very proud because we're doing it for veterans. And so thank you for moving this legislation forward, and we're doing it without any poison pill riders, and I'm just very proud of the work we've done today.
Thank you, Mr. Takano. Anyone else wish to comment? Seeing none, and since no amendments were timely filed, the question now occurs on passage of H.R. 2288. All those in favor say aye. Aye. All opposed, no. Opinion of the chair, the ayes have it. I now recognize Ranking Member Walls for a motion on reporting H.R. 2288.
Mr. Chairman, I move that H.R. 2288 be reported favorably to the House of Representatives.
All those in favor say aye. All opposed, no. In opinion of the chair, the ayes have it. And with great honor, the motion is agreed to, and H.R. 2288 is reported favorably to the full House. H.R. 1725 as amended. I now call up H.R. 1725 as amended. The clerk shall report.
H.R. 1725, to direct the Secretary of Veterans Affairs to submit certain reports relating to medical evidence submitted in support of claims for benefits under the laws administered by the Secretary.
Bill was circulated in advance pursuant to committee rules. Without objection, the first reading will be dispensed with. The bill is now open for amendment at any point. Do any members wish to offer an amendment to this bill?
Mr. Chairman,
Mr. Walsh, you're recognized.
I have an amendment to H.R. 1725 as amended.
The clerk shall report.
An amendment to the subcommittee print of H.R. 1725, offered by Mr. Walz.
I ask unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. The ranking member is now recognized for 5 minutes to speak in support of his amendment.
Thank you, Mr. Chairman. Just quickly, this is a technical amendment I'm offering to facilitate for House floor suspension rules to make sure it very simply it provides a sunset for the report by VA required in my bill of the numbers of veterans who submit private medical evidence and the reason why the agency didn't see it as adequate. Sunset for all studies passed in this Congress are required under the majority's conference rules. This just adds that sunset in after 7 years. Just very briefly, many of you have been involved with this for a long time. We've got a lot of veterans who have really good qualified physicians out in the private sector who do really good work, and the idea that you could not submit that data to support where you're at for your claim, I don't think gives the fair shake to the veteran. And to be very honest with you, it holds up the CMP exams and everything else that goes into it, and it takes focus away from at the VA to do things that have already been done. They're duplicative, and in many cases, they're much more extensive in the private sector of a veteran who's gone out and done all that. So again, I thank the chairman. This is, I think, thoughtful in terms of appeals reform to get on the front end of it so you don't have to get an appeal. You get a fully developed claim in the first place. It gives a fair shake, and you don't have to go down that road. So I thank you, Chairman, and I yield back.
I thank the gentleman for yielding. I will be supporting this amendment. Do any other members wish to comment on the amendment to H.R. 1725 as amended? Hearing none, since no other amendments were timely fashioned, the question now occurs on the amendment to H.R. 1725 as amended. All those in favor say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it. The amendment to H.R. 1725 as amended is agreed to. Is there any more discussion on the bill as amended? Hearing none, since no other amendments were timely filed, the question now occurs on passage of 1725 as amended. All those in favor say aye.
Aye.
All opposed, no. In the opinion of the chair, the ayes have it. And H.R. 1725 as amended is agreed to. I now recognize Ranking Member Walsh for a motion on reporting H.R. 1725 as amended.
Mr. Chairman, I move that H.R. 1725 as amended be reported favorably to the House of Representatives.
All those in favor say aye.
Aye.
Aye. All opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 1725 as amended is reported favorably to the full House. En bloc, H.R. 1329 as amended, H.R. 1005, H.R. 1662, H.R. 467, H.R. 1545, H.R. 1848, H.R. 91, and H.R. 1162. I now ask unanimous consent to consider H.R. 1329 as amended, H.R. 1005, H.R. 1662, H.R. 467, H.R. 1545, H.R. 1848, H.R. 91, and H.R. 1162 en bloc. Hearing no objection, so ordered, the clerk shall report.
H.R. 1329, to increase effective as December 1st, 2017.
The bills were circulated in advance pursuant to committee rules. I ask that the reading of the bills be dispensed with. Hearing no objection, so ordered. One of the bills in the en bloc agenda is my bill, H.R. 1848, the Veterans Affairs Medical Scribe Pilot Act of 2017. The use of electronic health records has become the norm in healthcare practice. While they provide a significant advantage in tracking data and improving patient outcomes, implementation and time it takes to input data into the record can become an obstacle for many physicians. And I jokingly say this, it was an electronic health record that made me a congressman instead of a doctor. However, the frustration that really did detract from the quality of the patient interaction significantly slowed down how smoothly my practice could operate. And just a quick, we were on a field trip. I'm not going to say where. I was out at a VA, and I walked through the emergency room, and I saw 5 healthcare providers in there, and not a single one of them was looking at a patient. They all were looking at a computer screen. And that's something we have to change, not at the VA, but in medicine in general. I think patients see that and recognize that they're not being looked at, the screen's being looked at. To address this disconnect between providers, patients, and productivity, many private practices have begun employing non-clinical staff whose sole purpose is entering physician real-time dictations into the patient EHR and helping the physician navigate the patient's existing record. While I didn't use medical scribes in my practice, I've spoken with several of my colleagues who do use scribes, and they greatly increase provider efficiency and time spent interacting with patients rather than with computers. My bill would create a 2-year pilot project where 40 scribes will either be contracted or employed by VA on a 50-50 split across 10 medical centers. There may be some disagreement about a contracted or employed split in this bill. However, an even split will bring an absolute transparency to the most appropriate staffing method for this pilot. In visiting multiple VA medical centers, my staff and I have always asked how we can improve efficiency and the quality of patients' interactions. And by far, one of the most common responses we hear is give us scribes. This is exactly what this bill is intended to do, and I urge my colleagues to support this bill. Is there any discussion on any of the other remaining bills or this bill? Dr. Winstrup, you're recognized.
Thank you, Mr. Chairman. First of all, I want to acknowledge that 7 of the 8 remaining bills on today's agenda originated in the Subcommittee on Health, and I'm very grateful to Subcommittee Ranking Member Congressman Brownlee and all of our subcommittee members and bill sponsors excuse me, for their help in moving these bills forward. All of them have my full support. One of the bills remaining on our agenda is my bill, H.R. 1662, which would prohibit smoking inside any Veterans Health Administration facility. It would prohibit smoking outside any VHA facility beginning October 1, 2022, and sooner if they so choose. And we will continue to encourage smoking cessation programs for our veterans and those employees in our VA. The devastating health effects of smoking on both smokers themselves and on those exposed to smoke secondhand are not new to any of us. Yet, believe it or not, a law signed in 1992 requires VHA to have designated smoking areas on VA medical facility campuses. Things have changed in 25 years. VA spends millions of dollars each year to maintain these smoking areas in accordance with this outdated law, which exists in direct violation of industry standards, best practices, and medical advice. Many DoD treatment facilities, as well as large national healthcare systems, to include Kaiser Permanente and Mayo Clinic, and more than 4,000 local and or state, territory, Commonwealth hospitals, healthcare systems, and clinics have adopted 100% smoke-free policies to protect their patients, employees, and visitors from the dangerous effects of smoke exposure. Veterans and VA employees deserve these same protections. I think you'd all agree, particularly when you consider that some veterans are especially vulnerable to the negative health effects of secondhand smoke exposure. Just last week, a letter of support for this legislation was signed by 14 healthcare agencies. I'm grateful for their support, and I urge all my colleagues to join me in support of H.R. 1622 and the other bills remaining on today's agenda. With that, I yield back.
Thank you all for the hard work that both you all have done in the Subcommittee on Health, and these are all bipartisan bills, and they certainly have my full support. Mr. Boss, you're recognized.
Thank you, Mr. Chairman. I'm just going to take just a minute if I can, and Ms. Estes has left, but I did want to thank her on another bill that is in this block. That's H.R. 1329, and that's the Veterans Compensation Cost of Living Adjustment Act of 2017. The bill should be a top priority for us this year, and that's because H.R. 1329 will ensure that veterans receive a cost of living increase next year if Social Security recipients get one. We all know that prices keep going up, and if veterans benefits don't keep pace, veterans and their families may have a hard time paying for basics like food, shelter, and clothing. This bill is extremely important to our nation's veterans, and as I ask all members to support it, I urge colleagues to support H.R. 1329, and thank you, Mr. Chairman, and I yield back.
Thank you, gentlemen, for yielding. Ms. Brownlee, you're recognized.
Thank you, Mr. Chairman, and I wanted to echo the words that the chairman of the subcommittee on health expressed. I agree wholeheartedly, and I think our committee and the members here have worked very hard to bring forward important bills for the full committee. I just wanted to speak very briefly towards H.R. 91. It is very, very important, I believe, that we continue to support the growing population of women veterans. I know last year I carried a bill around suicide prevention for our women veterans, and still today, women veterans are 6 times more likely to commit suicide than civilian women. I think this bill plays into that, where we have been very successful in a VA pilot program which brings women veterans together for counseling and a retreat setting, and these retreats have shown to be very helpful for our veterans coming home and dealing with many stress-related symptoms, and this bill would simply make this program permanent. I hope that the committee will support this bill and we can move it forward. Thank you very much for your attention to it. I yield back.
Thank you, gentlelady, for yielding. Any other?
Chairman. Yeah.
Oh, yes, you're recognized.
Thank you, Chairman. Just want to have a minute. It is in comments on H.R. 1005. And passing this legislation will allow the creation of satellite adult day healthcare services across the islands of Puerto Rico. And that will make it possible for service-connected veterans to attend programs that will enhance their quality of living in the island. And as a matter of fact, that will provide a lot of new services and will enable Puerto Rico to consider this program to provide a much needed service when we are having just one state veteran home in the island. So I do support this bill. I do support the H.R. 91 that has been supported here, and all the bills that are being promoted. H.R. 2288. Thank you, Mr. Chairman, for having this bill been passed in this markup, and thank you for letting us to be co-sponsor of that.
Okay. I thank the gentlelady for yielding. Any other comments? Since no other amendments were timely filed, the question now occurs on passage of the remaining agenda items. All those in favor say aye. Aye.
Aye.
All opposed, no. In the opinion of the chair, the ayes have it. I now recognize Ranking Member Waltz for a motion on reporting our remaining agenda items.
Mr. Chairman, I move that H.R. 1329 as amended, H.R. 1005, H.R. 1662, H.R. 467, H.R. 1545, H.R. 1848, H.R. 91, and H.R. 1162 be reported favorably to the full House.
All those in favor say aye.
Aye.
All opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and the remaining agenda items are reported favorably to the full House. Summarizing today's votes, the committee has voted to report favorably to the full House H.R. 1461 is amended, H.R. 2288, H.R. 1329 is amended, H.R. 1725 is amended, H.R. 1005, H.R. 1662, H.R. 467, H.R. 1545, H.R. 1848, H.R. 91, and H.R. 1162. I ask unanimous consent that the committee staff be authorized to make technical, clerical, and conforming changes to the bills favorably reported today. Hearing no objection, so ordered. And I ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and insert extraneous materials on any bills reported favorably today. Hearing no objection, so ordered. Mr. Walsh, you have any closing comments?
No, thank you, Chairman.
With that, I thank all members for their hard work and for their attendance today. The meeting is adjourned.
Thanks, Chairman.
Wow.
Good. That was good. That was fun.
That was a bunch.
Thanks, everybody.